Hello juniors, so I welcome you all again in the continued series of lower limb, and today we are going to continue an important topic related to the knee joint, which is the popliteal fossa. In today's topic I will be covering the introduction, boundaries, roof and floor, contents and clinical relevance related to the popliteal fossa. I've made a diamond shaped kite here just to make you this fit in your mind that something is related to diamond shape here. So without wasting any further time, let's move ahead. So starting with the introduction of popliteal fossa. So coming to the nomenclature, what does the popliteal means? So popliteal means something related to the back of the knee. Popliteal is something related to the back of the knee, and fossa means a depression. So fossa means a depression, while you will encounter a similar wording of fossa with the foramen, and foramen means the hole, while the fossa means the depression. So the popliteal fossa is a diamond shaped space behind the knee joint. As I've already told you, the popliteal means something related to the behind of knee joint. So it corresponds to the cubital fossa of the arm. So cubital fossa of arm is a triangular shape and popliteal fossa is diamond shape. I have covered cubital fossa in greater detail in my another video. You can check it out. So understanding with the help of this diagram, this animation, this is our diamond shaped popliteal fossa, which is behind the knee joint. And here is the diagram to make this thing more clear to you. This is our diamond shape fossa. So now coming to the boundaries of the popliteal fossa. Supralaterally it is constituted by the biceps femoris. So this is our lateral side and this is our medial side and this is the posterior view of the knee joint. So you are able to view the popliteal fossa. So superolaterally, this superior and lateral boundary is constituted by biceps femoris muscle. This is superior, this is the midline, this is the lateral and lying in superior region. So this is the biceps femoris muscle. Similarly, supromedially is by five muscles: semitendinosus, semimembranosus, gracilis, sartorius, and adductor magnus. So these are supromedial muscle, group of superomedial muscle, which constitute the supromedial boundary of popliteal fossa. This is our semitendinosus muscle. Beneath it is the semimembranous muscle, and beneath that is the adductor magnus muscle. In this diagram, you are only able to view these three muscles. With the help of the series of this diagram, this will make more clear to you. This is our lateral side and medial side. This is same for all pictures. So lateral, as I have already told you, superolateral is formed by biceps femoris. This is the biceps femoris muscle. And superior medial is by semitendinosus, semimembranosus. This is semitendinosus muscle. If I remove these two, if I dissect out these two muscles, I am left with, here is the semimembranosus muscle and here is the short head of biceps femoris muscle. If I dissect both of them, I remove both of them, which is the short head of biceps femoris and here is the semimembranosus muscle. I am left with the vastus lateralis here in the lateral side and left with adductor magnus muscle. This is the adductor magnus muscle on the medial side. And here you are able to view the gracilis muscle. Right here is the muscle gracilis, and if I further dissect out the gracilis muscle, I am left with the sartorius muscle right here. So all these five muscle forms the supromedial boundary of popliteal fossa. This was our popliteal fossa. Now coming to the inferior boundary, it is by lateral head of gastrocnemius muscle and plantaris muscle. So coming back to the diagram, this is our lateral head of gastrocnemius muscle and this is our plantaris muscle. So they both constitute the inferior lateral boundary of popliteal fossa. Coming to the inferior medial, the medial head of gastrocnemius. This is the medial head of gastrocnemius muscle. Coming to the roof of the popliteal fossa, the roof of the fossa is formed by deep fascia, and superficial fascia over roof contains small saphenous vein, posterior cutaneous nerve of thigh, peroneal or sural communicating nerve, and posterior division of medial cutaneous nerve of thigh. So he is saying that roof of the fossa is formed by deep fascia. If I cut the leg in this section and I view from downwards, I'll able to view this diagram, something like this, where this is the anterior, this is the posterior, this is our patella, and what here is saying that roof of the popliteal fossa is formed by deep fascia. So where is deep fascia? This is our outermost skin, and beneath the skin lies the superficial fascia, which constitute the adipose tissue or fatty tissue, and beneath that superficial fascia lies our deep fascia. So this is the skin, this is the superficial, and this one is the deep fascia. So the deep fascia forms the roof of the popliteal fossa. Roof of the popliteal fossa is formed by deep fascia and superficial fascia over roof. This is the superficial fascia over the roof. It contains small saphenous vein. This is the small saphenous vein. Posterior cutaneous nerve of thigh. Here is the posterior cutaneous nerve of the thigh. And the posterior division of medial cutaneous nerve of thigh. This is the posterior division of medial cutaneous nerve of thigh. And lastly, the peroneal or sural communicating nerve. So this one is the peroneal or sural communicating nerve. So this is another diagram that will make you understand more clearly. This posterior view of the knee. Here is the popliteal fossa, and over the deep fascia lies the superficial fascia. In that superficial fascia itself, there are three nerves running in that fascia. These three nerves are posterior cutaneous nerve of thigh, posterior division of medial cutaneous nerve of thigh, peroneal communicating nerve, and lastly one vein which is small saphenous vein. As the name of the nerve suggests their function, the posterior means it is lying in posterior section of the knee, and cutaneous nerve of thigh means it carries sensory information from the given area. Similarly, posterior division of medial cutaneous nerve of thigh. So something here is the medial cutaneous nerve and its posterior branch. It also serves as the same function, that is carry sensory impulse. Cutaneous means something related to skin. Carry sensory impulse from the thigh. Peroneal or sural communicating nerve. Peroneal or sural. Yes, sural means something related to the calf. So these are communicating nerve that supplies the calf muscle of the body. Coming to the floor of the popliteal fossa, the floor is from above to downward is formed by popliteal surface of femur, capsule of knee joint, and fascia covering popliteus. So here was the roof of the popliteal fossa. Now this constitutes the floor of the popliteal fossa. So the floor from above to downward is formed by, this is the popliteal fossa, diamond shaped fossa from above to downwards. This area and this area forms the floor of the popliteal fossa. Floor means structure are sitting over these surfaces, and these surfaces constitute the floor of the fossa. So at the topmost we have popliteal surface of the femur. This is the popliteal surface of the femur. Capsule of the knee joint. So the capsule of the knee joint and the fascia covering popliteus muscle. This is the fascia covering popliteus muscle. As I have already told you, popliteus is a triangular shaped muscle. So the fascia, capsule of knee joint and popliteal surface of femur constitute the floor of the popliteal fossa. Coming to the contents of popliteal fossa, first one is a popliteal artery. This is the popliteal artery. Second one is the popliteal vein, and third is this tibial nerve. The tibial nerve. I have covered all these in a great detail in my knee joint video. Common peroneal nerve and its branches. This is the common peroneal nerve and its related branches. Posterior cutaneous nerve of thigh, as I have already covered this. Posterior cutaneous nerve of thigh. Genicular branch of obturator nerve. So genicular means, I have already told you, genicular is something related to the knee, and the branch of obturator nerve also lies in the content of popliteal fossa. Popliteal lymph nodes, these are the popliteal lymph nodes which carry the lymph from the lower limb, and fat surrounding the leg. So this was the fat, this whole surrounds the leg. Now sometimes the examiner is also interested in asking the arrangement of popliteal artery, popliteal vein and tibial nerve. So examiner often asks the arrangement of all these three regarding the popliteal fossa. So at the top, this is the medial side, this is the lateral side. So in upper section right here of the popliteal fossa, the artery is lying medial most, the vein is lying in between the artery and the nerve is lying lateral most. So this can be remembered by AVN. In the middle section, right here at the joint, the nerve crosses the artery and the vein and comes medial most in respect to the artery and vein. The vein goes beneath the nerve and it comes once again in the middle, in between the nerve and the artery which was medial most in the uppermost section, it goes to the lateral side, and in the lowermost region of popliteal fossa, this this fashion continues. That is, the nerve is now the medial most, vein in the middle and the artery in the lateral most side. Coming to the clinical relevance of the popliteal fossa, as I have already told you, popliteal lymph nodes, these are the popliteal lymph nodes are one of the content of popliteal fossa. So the lymph nodes get enlarged in infection on the lateral side of foot. So you can see these enlarged lymph nodes. These are lying along the short saphenous vein. As I have already told you, these are the lymph nodes, and this is the short saphenous vein. They are lying along the short saphenous vein. Lastly, the common peroneal nerve, it may be injured in this area as it is the most frequently injured nerve in the lower limb. This nerve is relatively unprotected. So this is our common peroneal nerve. I have already shown you this. In this diagram, this is the common peroneal nerve. And he's saying that this nerve is relatively unprotected. I'll show you this, why this is relatively unprotected. So this is our fossa and these are the muscle. You can see the common peroneal nerve in, I've given it the one number. This common peroneal nerve has no protection from above or downwards. That is, it is lying just beneath the skin muscle and it has got no muscular protection or anything. So the nerve is relatively unprotected. It may get entrapped between the attachment of peroneus longus or the head or shaft of the fibula. Patient present with foot drop, which is usually painless. So I'll cover the topic foot drop exclusively in another video in detail. So by the way of review, foot drop is the occurs when there is a palsy of common peroneal nerve. There is weakness in the dorsiflexion of ankle and eversion of the foot. So what he is saying that if common peroneal nerve get palsy, there will be unopposed plantar flexion. So this is the plantar flexion movement and this is the dorsiflexion movement. So if the common peroneal nerve supplying the muscle for dorsiflexion get palsy or get traumatized, so there will be unopposed action of the muscle responsible for plantar flexion. If you found this video helpful, do like it, do share it with your friends. And I have already covered knee joint in great detail. Do check out that video before watching this video. Thank you.